Our predictions for Obamacare. What's really going to happen with the Affordable Care Act? I foresee that's what you'll learn on today's Liberty News TV report. I'm Norvell Rose. You may have heard that Nancy Pelosi recently suggested we all celebrate on this July 4th health independence as the dawn of Obamacare is fast approaching. Not that we're taking Madam Pelosi's advice, but it is true that the biggest changes in health insurance coverage are set to take effect less than 3 months from now, October 1st. That's when people can start signing up for coverage in those new state health exchanges, if they exist. But as the hyping and griping about OCare intensify, what's really going to happen with the Affordable Care Act? Really? The truth? Who knows? But based upon what is known and can be seen, we've got a few predictions. Prediction number 1, public opposition to Obamacare will continue to increase. Right now, most surveys show that we the people are not happy with the prospects of OCare. Its popularity sinks, its disapproval rises. And with health insurance premiums on the rise, some reputable forecasters now say the cost of individual policies will double, even triple. With that, more and more consumers will become more and more upset. So despite Team Obama's continued efforts to convince us the costs of health care will go down, they will not. They will go up. And no amount of magical thinking will change that. And for other reasons, the public will continue to turn against the law, as it reduces the number of practicing doctors, as it makes excellent health care less available, as it swells the federal budget deficit, and as it negatively impacts the job market and the number of hours that small business is willing to employ workers. Which brings us to prediction number 2. As public sentiment continues to slide ever downward, Team Obama's efforts to recruit messengers and ambassadors and promoters for OCare will grow to a frenzy. Already they're going after Major League Sports, librarians, California school students to market Obamacare to a wary public. Who else will they try to recruit to sell the dream? Police, firefighters, sanitation workers? Well, garbage men and Obamacare. Now there's a connection. Prediction number 3, the health insurance exchanges, whose implementation is essential to Obamacare's success. They will not work as planned. Already many states are refusing to set up the exchanges, so this major gear in the OCare machinery will not engage, severely impacting health costs and the availability of care. Prediction number 4, another major component of the law, the state's expansion of Medicaid coverage. It'll fall far short. Already fewer than half the states have accepted the expansion. A massive Medicaid gap could actually gut the law, leaving many of the poor uncovered, a potentially fatal breakdown. Finally, our prediction number 5. With midterm elections on the way, many Republicans and even some moderate Democrats will build their campaigns around fighting the increasingly unpopular Obamacare, even repealing it. Most Democrats, though, will simply double down on those promised benefits of the law, ignoring the facts on the ground, disregarding reality, instead taking this tack. Obamacare would have worked as planned. All would have been well, except those mean, nasty, Obama-hating, obstructionist Republicans got in the way and screwed things up. You know, this kind of Obamacare Independence Day discussion is probably not what Nancy Pelosi had in mind. That is Liberty News TV for today. I'm Norvell Rose. Thank you for joining us, and we do look forward, as always, to seeing you right here next time.